Good morning, everybody. Welcome to the second consecutive virtual AARP Arizona Day at the Legislature. We hope to have as good and productive a session this year as we did last year. Although next year we're hoping we'll go back to having our days, a day at the Legislature on the front lawn of the Legislature in person. Although from my point of view, the success of this format, we might want to repeat. I'm Hal Bergsma. I am the new chair of the AARP Arizona Advocacy Steering Committee. I recently succeeded Bob White, who was the past chair for the last couple of years, who had succeeded his wife, Marquita, who was chair for a few years. And I'd like to take this opportunity to thank both of them for their excellent service to AARP Arizona, as well as their leadership of the Advocacy Steering Committee. I also want to say thank you to all our esteemed guests who you'll be seeing later in the program. And we look forward to their remarks and ensuing conversation, and we look forward to working with them all moving forward. As a note, each conversation will be moderated either by an AARP volunteer, such as myself, or a staff member. And also, you will have an opportunity after the presentations to ask questions. Please do that via the chat function on Zoom. We'll be monitoring the chat to see what questions come in. And to begin the presentation, I'd like to introduce AARP's Director of Advocacy, Brendan Blake, who will discuss what we hope to accomplish in this legislative session at the state legislature. So Brendan, there you are. Why don't we start off by going over the issue priorities we had for this session, and tell us a bit about how we're doing in achieving those priorities.
Great. Thank you so much, Hal. Really appreciate everybody for being with us today. We had a number of priorities coming into this year, including in the areas of long-term care, work and save, which we'll definitely talk about a little bit later, as well as utilities, as well in our priority at the national level around the high cost of prescription drugs. And we had a number of issues that we worked on as well at the state capitol, including housing and homelessness, which we'll also talk about later in the program. So how we had a number of things that we worked on. And if you'll give me a moment, I can talk a little bit about some of the things that we were able to work on.
Okay.
So one of the biggest things that we worked on was around what we call work and save. And again, we'll talk about this a little bit later in the program, but essentially what we wanted to highlight is that not enough people save enough money before they retire. And one of the biggest goals of AARP is making sure that people are able to live how they choose as they age. And one of the factors that they need in order to do so is to be able to have enough money to do so. And one of our biggest priorities across the organization has been to increase the amount of people that money can have in their retirement and giving them options to save. So outside of that, we did have a number of big wins in the area of utilities. Speaking about finances, we were able to, in the most recent rate case at the Arizona Corporation Commission, secure a rate decrease for those who are in APS's service territory, as well as a number of other changes. Another big win that we got recently was around the APS and other power company summer moratorium ruling at the Arizona Corporation Commission. Starting, I believe it will be starting next year. There will be a moratorium throughout the summer that you cannot have your power turned off for a number of reasons. We are one of the first states in the nation to have a summer moratorium. Arizona, funny enough, actually has a winter moratorium in place for the colder parts of our state. And it's a common practice in other states to have winter moratoriums as well. But Arizona is one of the first to have a summer moratorium. So it's a huge win and something that we have been working on for over 4 years at this point.
And I think I just point out here that when we're talking about our advocacy efforts, it's not just the legislature, it's also groups like the Arizona Corporation Commission that we're involved with.
Right, right. We work on advocacy issues at the Arizona Corporation Commission and at the state legislature, as well as with our members of Congress, as well as even some of our local elected officials at the city level.
Right.
Right. The other thing, Hal, if I can mention, is that one of the biggest issues that we will talk about a little bit later on, it's one of the reasons why we wanted to wait and have some legislators come on our program today, is the issue around housing and homelessness. We all know that one of the biggest issues that we're facing in our state currently is around housing and homelessness. We are specifically seeing an increase in the number of people experiencing homelessness who are seniors. About 2/3 of the people who are experiencing homelessness for the first time in this sort of boom we've had of people experiencing homelessness are people over the age of 55. We are just seeing an incredible number of these people who are now starting to experience homelessness for the first time in their lives, and this could be due to they're late on their property taxes. They are struggling with one medical bill that has sort of, they're living paycheck to paycheck when it comes to their Social Security checks, and they have one big expense, whether it's a home expense or a medical expense or whatever the case may be, or just the cost of their prescription drugs are finally catching up to them, and they cannot afford to live in their own home anymore, which is unfortunately an unfortunate tragedy that we're seeing. Hal, I know that you work a lot on the area of housing and homelessness. Is there anything else that you want to sort of prime for our conversation a little bit later?
Well, the only thing I'd say, going back to your point that we work with various groups, including folks at the local level, is that in terms of housing, a lot of what happens is at the local level in terms of zoning issues, development of affordable housing, and so on. And I'm in Tucson, Arizona, and we've got an effort going on right now to develop an affordable housing action plan for older adults in this area, and hope to have that done here the next month or so. That will guide us going forward. So there's a lot happening both at the local level and, as we'll find out later, at the state level regarding housing and homelessness.
Right. And the one other thing that I'd like to talk about as sort of something that AARP has been working on is around voting law changes. But before I do that, I just want to make sure that everybody remembers to put any questions that you have in the Q&A or the chat sections at the bottom of your screen. I'm more than happy to answer any questions about our priorities and things that we've been working on at the state level. But the last part that we'll talk about, and we're going to have a great guest on as part of our first session to talk about this, but some of the voting law changes, as well as AARP's role in the upcoming elections. We are hoping to do a lot of voter education, as well as our typical candidate education, where you can expect to see video voter guides or teletown halls from us with some of the people who are running for election, whether they be at the state level or the federal level. That's one of the issues that we'll be working on. But I'm very happy to be able to bring on a guest to talk about the voter education side of things shortly. It looks like we did have.
Yeah, we've got a few questions or comments in the chat. One, well, let's go to the one at the bottom, which is, could you explain the format for the webinar? I never received any info on this. You want to talk a bit about the format, Brendan?
Yeah, sure. I'll go ahead and run through the program. Thank you so much, Melissa, for bringing this up. So the way that this is going to work is we will have a panelist come on. They will be moderated by staff or a volunteer like Hal here. And the first thing that we'll be talking about is around our voter education side of things, some of the voter law changes that we've seen over the last couple of years that will impact you in the 2022 election. We'll have a bit of a robust conversation and overall and general conversation about the 2022 election and how to have your voice heard as a voter. Then we'll move on and we'll talk a little bit about COVID and also the role that access plays in our state. And for those who do not know, access is our state Medicaid program. After we have a conversation with a representative from access, we'll then move into conversations with state legislators. We were hoping to have them earlier in the program, but given their schedule with their work down at the Capitol, we have had to adjust to get them later in the program. So we will be talking about some issues that AARP has been focused on. Specifically, we will be focused on the Work and Save program that we just mentioned a little bit ago, as well as the affordable housing and homelessness issues that we're also facing. And we will have 3 separate legislators to come on and talk about those issues. Afterwards, we'll go ahead and wrap up, and then we'll get you out of here. So, Melissa, I hope that answers your question. Hal, do you want to add something to that?
No, that's fine. Couple more, at least one more question from your predecessor, Steve Jennings. Will there be a legislative study of the Work and Save issue?
Yeah, we'll go ahead and get to that, Steve. But as a little primer, yes, we are hoping that there is going to be a legislative study, a study committee to look at the issue around retirement savings for people in Arizona. But that is certainly something that we are hoping to have.
Also, there's a question, I don't know if we can really answer this question, but maybe we can broaden the question. This is from Karen McKee. Her issue seems to be legalized medically aided dying. We don't have that as a priority, but maybe you could talk a bit about how our state priorities relate to national priorities.
Sure. One of the ways in which AARP determines how they can support how they can support an issue is through what we have through what we called our policy book. Our policy book is a collection of issues ranging from utilities, telecommunications, healthcare, prescription drugs, transportation, housing, things like that. And we have experts who look at these issues and determine if AARP is able to support or oppose things. Generally, it is up to the states to make the decisions for what makes sense for their states. And so if there's ever a question on if you think that AARP should be supporting something, you can go to AARP's policy book in Google, and you'll be able to see what our policy book says about any particular issue that you're looking forward to seeing.
We have another question. We have a couple of minutes to go. We'll try to get these in. Question from Bob Cruz says, related to the top priority of saving for retirement, he has a concern about the upcoming flat state income tax and how that might affect retirees. And where is AARP in trying to well, where's the legislature on this? And I think the legislature's already taken their action. And what is AARP trying to do to accomplish relative to this?
Sure. AARP was not in support of the flat tax proposal last year. I know that there's currently the issue around the legality of it. And so we'll have to wait and see how that sort of plays out, but as of last year, and our position has not changed since then, we were not in support of the flat tax.
And actually, the state Supreme Court just came out with a decision on Thursday, I believe, rejecting the ability for voters to take that out for a referendum. So apparently that's going to be permanent. And then one more real quick question. Can you give me a website for the policy book?
Sure. I will give that. I will put the website for the policy book in the chat for everyone to see.
Right. And there's a lot of other good stuff on the AARP website. Questions regarding housing are addressed in the livable communities section and so on. So there's a lot to explore there.
Right.
So I think we're at about the time on our agenda where I am going to turn it over to you, Brendan, to moderate a discussion with Regina Roberts, who's the Voter Education Director for Arizona Clean Elections.
Yes, thank you, Hal.
Right.
See ya. We'll see you in a bit. All right, it is my pleasure to bring on Regina Roberts. She is the voter education director over at Arizona Clean Elections. And Gina, can you come off mute and on to camera so we can see you?
Hi, good morning, everybody.
Hey, how are you, Gina?
I'm good. Thank you for having me today.
Of course, of course. We can't have any kind of discussion around elections without bringing you on. And so I was hoping that you could just sort of give our attendees sort of a snapshot of what Arizona Clean Elections is and what you all do.
Sure. So Clean Elections, we are a state government agency, and we were actually created by voters in 1998 through a citizens initiative. So we've been around for a couple decades now, and the our primary purpose is voter education. So voters enacted the Clean Elections Act and stated that Clean Elections will sponsor debates for statewide and legislative candidates, and that will send a voter education guide to every household with a registered voter for both the primary and general elections. And in addition to that, our goal is to promote participation in the political process. So what that means is we basically provide voters all of the logistical information that they need in order to vote, such as how to get their ballot, key dates and deadlines, but also help them learn what's on the ballot, learn about the candidates and the issues. So our office, again, we're a state government agency. Everything we put out is nonpartisan, and it's basically a trusted source of information for voters so that they can get all of their election information.
Great. And I just wanted to clarify, you did say that you are nonpartisan and all of the things that you put out are nonpartisan as well, right?
Correct. Nonpartisan and non-influential too. So everything we put is nonpartisan, and it's not meant to influence voters, just simply to educate.
Great, great. I think that one of the biggest things that we're seeing right now is there are a lot of changes to our voter laws and things of that nature. Can you sort of walk through some of the biggest changes that we've seen over the last couple of years that will impact people in the 2022 election?
Sure. So let's start with one of the big ones, which actually the state legislature adopted in the last legislative session last year, and that's the law. It was at the time Senate Bill 1485, and that made some pretty big changes to Arizona's at the time what we called the permanent early voting list. So that bill changed it to where it's now called the active early voting list. And essentially what this means is here in Arizona, you can sign up for the active early voting list, and you can request that your county recorder automatically mail you a ballot for every election you're eligible to vote in. So you don't have to continually make a request every time an election comes up. You get on the active early voting list, you're set, they're going to automatically mail you your ballot. However, with the new changes from Senate Bill 1485 last session, there is now a mechanism for a voter to be removed from the active early voting list. So if a voter fails to vote one of those early ballots that is sent to them over a course of 4 elections, so 2 consecutive election cycles, so think from a primary in, let's say, if it was active, then if it was in effect, primary 2020, and they didn't vote that one, didn't vote the general 2020, didn't vote the primary 2022, didn't vote the general election early ballot in 2022. Those are 4 elections. Then that triggers a notice from the county recorder to that voter saying, hey, you didn't vote at least one of these 4 early ballots that were mailed to you. Do you want to remain on the active early voting list? And if the voter fails to respond to the county, then the county can remove that voter from the active early voting list so they are no longer automatically mailed their early ballot. It's very important to distinguish that that does not mean removal from the voter registration rolls. It just means the county is no longer going to automatically mail you your ballot. And as a voter, you can always re-sign up. We just want to make sure that there's no voter confusion out there in case the voter just doesn't vote through those 4 elections. And maybe they're expecting an early ballot in the mail and it doesn't come through. So that's probably one of the biggest changes that will impact voters. And the clock starts ticking with that. It's now in effect. So it will impact voters with the upcoming primary and general elections this year. There are 2 more bills that the legislature passed this year, if you wanted me to touch on those, Brendan.
Yeah, we will, but I do want to ask a clarifying question regarding the active early voting list.
Mhm.
So if for instance, you didn't vote in the 2018 and 2020 election cycles, would that mean that you should have or will receive a notification from the county recorder's office?
No, because the bill was not retroactive. So we are only going forward. So the clock starts ticking this year. So if you do not vote your early ballot, if you're on the active early voting list and you don't vote your early ballot for this upcoming primary election, then that's going to be your first, I don't want to say strike, but counts as like the
Sure,
first one,
sure.
the first time. So the clock starts ticking this year.
Great. And we have a question from Jeanette. If we are currently receiving an early ballot, is there any action required by the voter?
In regards to the active early voting list, no. So if you just, if you want to vote that ballot, great. If you don't vote it, as I said, it could be, now that's 1 out of 4 that you didn't vote. However, if you are, and this kind of jumps ahead a little bit, but if you are an independent voter, then yes, there are actions that you need to take. So I don't know if we want to hang on to that question for just a moment, and I can touch on that later.
We will hang on to that question, yes. We have another question from Barbara. We are new to Arizona and voting here. Where is the best place to find our polling place in person?
Perfect. So thank you and welcome to Arizona. However, what you first need to confirm is, does your county actually use polling places, or do they use vote centers? So we have 2 different types of in-person voting locations here in Arizona. If it is a polling place county, what that means for voters in Arizona is that you are required to go to your assigned polling place. Some of our counties, like Maricopa County, uses vote centers, which means you can go to any voting location in your county. So the best place that I would drive people to is to azcleanelections.gov. That way you don't have to search a bunch of different places. We have it broken down for you by county. All you need to do is type in your address in our voter dashboard tool, and it's right on our homepage. You can type in your address and we can pull up those locations for you. It's important to know that those locations are not available right now for the primary, though. The counties are still securing those voting locations right now in preparation for the primary.
Great. All right. I think we'll go ahead and move on to the voter changes for this year. Gina.
Great. Okay, so the legislature this year so far has, the governor has signed 2 bills in regards to new election laws. So the first one, this has received a lot of attention. It's House Bill 2492. It was signed by the governor on March 30th. There's a lot to unpack in this bill, but before I get into that, I do want to first clarify that there are currently 2 lawsuits right now that are challenging that bill. So it is yet to be clear whether or not this law will actually go into effect. And if it does go into effect, then the general effective date would be 90 days after the legislature adjourns, after sine die. So it could potentially impact the general election. And it has to do with registered voters and voter registration in terms of citizenship and proof of citizenship. So right now, in Arizona, to register to vote, to be able to vote in state elections, so let's say for governor or secretary of state or your local city or county candidates, you do have to provide proof of citizenship. And this was based off of a citizens initiative. Proof of citizenship would be a copy of your birth certificate, your passport, or your driver's license information. We have also in Arizona a bifurcated voter registration system. What that means is that there is a federal voter registration form, and this is through federal law, that requires Arizona to accept and use the federal form for people when they're registering to vote. But proof of citizenship is not required there. So what that means is that the voter is attesting under penalty of perjury that they are a citizen. So we essentially in Arizona have 2 types of voters. We have a voter who can vote the full ballot, all the races, and then we have another voter who can only vote in federal elections. They're called a federal only voter. House Bill 2492 impacts federal only voters, where it states that they are now not eligible to vote for president, and they are not eligible to vote a ballot by mail. So those are 2 impacts from this bill. The other components also impact how counties process voter registration forms in terms of confirming proof of citizenship. So if a voter fails to provide proof of citizenship, the county can use basically all of the resources available to them to verify that person's citizenship, whether it's records at MVD or Social Security, things like that. The other requirement is their voters have to provide proof of residency when they are registering to vote. So you have to provide proof that you do in fact live at the address that you're putting on your voter registration form. The other component of this too is the Attorney General's office. The counties have to provide the AG's office a list of all of the federal only voters, and then the Attorney General's office will then attempt to do verification for citizenship, and they can also do investigations as well. So there's a lot to unpack in this bill. Again, I don't know if it will go forward based off of these lawsuits. So really the most important impact that voters need to be aware of is, if you're not currently registered to vote, you just want to, and once you do actually register, you want to make sure you do provide your proof of citizenship. So as long as you do that, then you'll be good to go. You don't have to worry about this bill.
Yeah, there
And there's
certainly
one
is a
more I
lot
can
to
talk about
unpack.
unless there's questions. Sorry.
No, I don't see any other questions about that one specifically. We do have a question, but we'll go ahead and get to that one after we talk about the next one.
Okay, and the last one, pretty simple bill. It was Senate Bill 1638. It was signed by the governor on April 22nd, just a few days ago. So essentially what this bill requires is that the counties provide an accessible method of voting by US mail for blind or visually impaired voters. So if you are blind or visually impaired and you would like to have an early ballot mailed to you, your county now has to make sure that you have an accessible method of voting that. So the most common thing would be a Braille ballot. Let's say that your county then produces a Braille ballot for you and mails that to you, and then you can vote that Braille ballot and send it back through the mail. That's the best example I can think of. So this bill is really just more about making sure that our voters who again are blind or visually impaired have the same opportunity to vote as any other voter would through mail, and that they have that accessibility option.
Great. Thank you, Gina. And you're right, that first one does have a lot to unpack. So I appreciate you running through with us all of the sort of provisions there. Thank you.
Sure.
So we do have one question, and then we'll go ahead and move over to the independents. Can you explain ballot harvesting and what the controversy is?
Sure. So that term we've heard it be called a few different things. We've heard ballot harvesting, we've heard ballot collection. So the history behind this is essentially there would be groups, whether it was a political party or get out the vote groups, that would go door to door and they would offer to collect a voter's voted ballot and return it for them. So we could potentially see a single person showing up at a county elections department office with multiple ballots and turning them in. The legislature enacted a law that prevents that. They basically state that only certain people are eligible to return another person's ballot. So that typically would be somebody within your household, a family member, or a caregiver. So state law says that nobody can be in possession of a voter's voted ballot and return it for them unless, again, you are a family member, somebody in your household, or a caregiver. So that was the legislature's response to this so-called, ballot harvesting controversy, if you will. So again, there was, when the legislature adopted that bill, a lot of the discussion that we heard down at the legislature at the state capitol were concerns about fraud, were people coming in with armfuls of ballots. And, is it really secure when it leaves the voters' hands? Could they have been tampered with? That type of thing. That was the discussion that we heard down at the Capitol regarding that. So again, we were seeing people offer to return voters' voted ballots. The legislature took action, and now only certain people may be in possession of the voters' voted ballot and return it.
Great. Thank you, Gina. Appreciate it. Let's go ahead and move our focus over to independent voters. You kind of teased it a little bit earlier, but how, as an independent, do you go about voting? Specifically, let's talk about voting in the primary, because I've heard that there are not a lot of independents that recognize that they can vote in primaries, which they in fact can do. How do you go about doing that?
Sure. So that's actually really important for our primary elections, because historically we have very low turnout in the primary, think anywhere from 20 to 30% turnout. And right now, as of today, there are 1.4 million registered independents in the state of Arizona. They are the second largest voting bloc. And so we definitely have our work cut out for them in educating these voters so that they know they can vote in the primary, because Arizona has an open primary system. And this stems actually from a citizens initiative in 1998. Arizona voters passed a constitutional amendment allowing independent voters to vote in party primaries. So a lot of the confusion comes around between, well, how does that process work? Because what we hear from independent voters is, well, I don't, is there just one ballot that I can get that has all of the, candidates from all the parties across the board? And there's not in the primary. In the primary, the ballots are actually created per party. So there's one ballot for Republican voters, one ballot for Democratic voters. The independent voter has to choose which ballot that they want to vote. So if you are a voter, you can definitely vote in the upcoming August 2nd primary. You have to take action by telling your county which party ballot you want to vote. So if you're voting in person, whether it's earlier on election day, you just simply tell your poll worker. So when you walk into the polls, you just say, okay, I'd like to vote the Democratic primary ballot. I'd like to vote the Republican primary ballot. If you vote early by mail, and this goes back to being on the active early voting list. So again, if you're on the active early voting list, county automatically mails you your ballot, except for independent voters. It will not automatically be sent to you because the county doesn't know which party ballot to mail you. So as an independent voter, if you want a ballot mailed to you, you must tell your county recorder which ballot you want mailed to you. And your choices, again, are either the Democratic Party ballot or the Republican Party ballot. There may be, depending on your location, there may be a local nonpartisan ballot where you're only voting, let's say in a city race that's nonpartisan, and you won't have any of those state election offices on there. If you don't want to vote in that, that could be potentially another option, but primarily it's going to be the Democratic ballot or the Republican ballot that you as the independent voter must actively tell your county to send you.
Okay. And so when you said that you can go into any polling location, for instance, if you're in Maricopa County, because we have the vote centers, you can go anywhere in the county. So do you need to bring any your ID card, your county ID card that says what party, or in this case, non-party you're affiliated with, in order to get that?
No. So what happens when you go into the voting location? You do have to bring ID just to identify yourself as a registered voter. What's going to happen is the poll worker will take your information, they'll look up your voter registration record in the e-poll book, and it'll pop up and it'll show them that you are registered as, we call it an OTH, you're an other voter, which is essentially an independent voter. And then the poll worker should actually ask the voter directly, okay, you're an independent voter, which ballot do you want? You then make your selection, and then the poll worker will issue you that party ballot.
Great. And so one of the questions that I've heard before is, if I tell my county that, say, I want a Republican ballot, will that mean that I'm a registered Republican?
Absolutely not. So your ballot selection will not impact your voter registration record in any way. So it will not change your voter registration in terms of how you are affiliated or unaffiliated. So if you're a registered independent voter, you select, let's say, the Republican primary ballot in the August 2nd primary, you vote it, you still remain an independent voter. You just simply participated in that party's primary, but it does not change your voter registration record in terms of showing you as an independent voter.
Great, thank you. I do want to remind everybody, if you have any questions, to please put them in the chat or the Q&A. We are monitoring both. And while we wait for some more questions, Gina, I do want to ask another one regarding independent voters. So one of the other things that we've heard quite often from our independent voter members is that the process can get confusing about sort of the deadlines that they have to meet, because they can, they, especially for the primary side of things, what are the deadlines for them to get their information to their county by, to say, if they get a mail-in ballot, what party they want to vote on?
Sure. So that deadline is going to be 11 days before the primary election. So that deadline is actually for anybody who wants to get a ballot mailed to them. So the last day to request a ballot by mail is July 22nd. So what that means is you have until July 22nd to contact your county and request a ballot be mailed to you. If you are an independent voter, you have until July 22nd to contact your county and request which party ballot you want mailed to you. And that's deadline, that 11 days out, is simply so it allows the county enough time to process your request and make its way through the US postal system to get to you. So again, it's going to be July 22nd. We obviously encourage voters to not wait until the deadline. So you can go ahead. What's going to happen is your county's going to mail you what's called a 90-day notice. So 90 days out from the primary election, you will receive a letter in the mail from your county recorder's office. It's going to say that you are on the active early voting list, and this is for our active early only list voters only. It'll say you're on the active early voting list. Here's the information we have for you. We show that you're an independent voter. Please contact your county and tell us which party ballot that you want, and they'll give you instructions on how to do that. So we encourage people to respond to those 90-day notices. That way the county can get your request in as soon as possible. And come the day that early voting starts, which is going to be this year for the primary, July 6th, you'll be part of that first group of ballots that go out. So we encourage those early birds.
Great, thank you. And we did just have that question exactly, so thank you for answering that. So here's another question that we just got in the Q&A. How do you prevent seasonal residents from voting in both states?
It's a great question. So it is very important to understand that somebody can only be registered in one location at a time. So yes, we do have voters who maybe have, let's say a winter home or a summer home elsewhere. So the voter needs to pick what their primary residence is and be registered to vote in that location. So some of the things that the state of Arizona does is we participate with national groups to identify potential duplicate voter registrations. We call it the ERIC system. It's the Electronic Records and Information Center that Arizona is a member of. So there are other things too that the county does. They look at national change of address information with the post office. And it's important to note too, and this is actually really important because the primary is August 2nd. And as I mentioned, early voting begins July 6th. That's right in the middle of summer. So it's right after Independence Day. We're going to see people who are going to be temporarily out of town, maybe on summer vacation, not maybe really thinking about voting yet. Ballots are non-forwardable. So if a ballot gets mailed to you, and let's say you have set up with the postal system temporary forwarding for your mail, it won't get forwarded. It's going to go back to the county. And so this is a system that the county uses to identify if a voter has moved or changed residences. So the county recorder's offices, again, they work with other states across the country to identify if there has been any change in voter registration. So for example, if a voter moves to California, they fill out a voter registration form in California, there's a section on there to identify, have you been previously registered to vote in another state? If that person marks down Arizona, then the California office is going to contact Arizona and say, hey, we've got this request here, make sure they're canceled in your system. So a lot of it, again, is communication with other states across the country, participating in these information sharing groups such as ERIC. And then again, the processes and the laws that we have in place through the National Voter Registration Act help prevent those duplicate registrations.
Yeah, that's great. It sounds like it's a great question. So thank you for that one. It sounds like we've got a system to try to really, knock down the opportunities to maybe vote twice and limit confusion as we count ballots. We do have another question. How many are likely to be knocked off the early voting list due to missing voting in 2 consecutive elections off of the now active early voting list? I believe it's what it's referring to.
That's a great question. And we don't really have estimates because, again, it's not retroactive. So it's not looking at a person's history in terms of whether or not they participated in that election. So we're moving forward in the, sense that it's going to take multiple years. The voter has multiple years, and, those 4 elections will include a presidential election. And that's typically when we see high voter turnout and the more likelihood of somebody to vote in that election. So again, if they do miss that 4, it's not going to be an automatic removal. It still triggers a notice from the county. So the voter will have multiple opportunities to still remain on that list and confirm their intent to remain on that list. So, I don't have an estimate, but, hopefully we'll continue to educate voters about that process. Hopefully voters will vote the ballots that they're being sent. And again, like I said, those 4 years will include a presidential election. So again, we'll have that higher turnout rate. So hopefully not too many voters will be impacted, but until we actually start to get the data in and we track that, there's just no estimates.
Yeah, thank you, Gina. We do have a question to clarify something. Did I hear correctly that the new law that is being contested in court requires voting in person for federal elections, even if I am on the active early voting list?
Yes, if you are currently registered to vote right now as a federal only voter, which means you did not provide proof of citizenship, and means you may only vote in federal elections such as US Senate or Congress. This new law 2492 states that federal only voters may only vote in person. They may not vote a ballot by mail. So that is what the bill states. Again, it's a lot to unpack here with what happens with the lawsuits and also how it's interpreted as well by the counties and the Secretary of State when they go to develop the procedures manual and actually implement this. But that is what the bill currently states right now.
So yes, if you are on that active early voting list as a federal only voter, if all stays the same and the lawsuits are unsuccessful, then you will have to vote in person. So thank you for that question. It's a great question. And how big is the estimated role of dark money in Arizona elections?
That's a great question. So, we've heard about dark money being in Arizona, especially, and making an influence. And that's been going on for years now that we've heard about. So, I think what we're seeing in the past few years is more and more political dollars are being spent in Arizona. In fact, when you look at this last election, Arizona was one of the primary areas for those political dollars to come into. And a lot of that has to do with Arizona kind of being, well, some people do like to call it a purple state. Some people argue on that, or a swing state. But the reality is Arizona is a big target when it comes to political dollars. And that is expected again for this year too. We have our US Senate seat that is open and our gubernatorial seat as well. It's getting a lot of national attention. So what does that mean? Well, let's start by trying to define what dark money is for those of you that don't know that. So essentially, dark money is not being able to trace the source of the original let's say election dollars, right, to the original source. So what we see typically is, let's say that there's a organization, Save the Puppies, right? And, Save the Puppies spends $100,000, it makes $100,000. And this is a nonprofit company, right? Let's say that they make a contribution to a political committee, right? Let's say a state party political committee of $100,000. And then that state party, who is then required to do campaign finance disclosure, reports all of their expenditures for $100,000. But where's the original source of money? Who were the donors to that campaign for, support the puppies, or I forgot what I said, but who were the contributors there? Where did that $100,000 come from? And who were the people who decided to make that contribution? We don't actually know that original source of information. So that's kind of what dark money means, is not being able to track it down to the original source. And, I think at the end of the day, there's really prominent discussion between our state legislators about where's the balance between disclosure, but also we've heard freedom of speech, and First Amendment rights and things like that. So I think in terms of how much money is going to be coming into Arizona, as far as what percentage of that is dark money, I don't know, but I can tell you there are a lot of political dollars that are hitting our state, both since 2018, really, since 2016, right. Actually, Arizona is a battleground.
Right. Well, Gina, we are at the end of our time. Thank you, everybody, for your questions. Gina, do you have any closing comments before we move on?
Sure. I would actually just encourage everybody to, again, if you're not currently registered, get registered to vote as soon as you can, provide that proof of citizenship, verify your registration. If you're an independent voter, be on the lookout for that 90-day notice from your county. If you don't get it, perhaps just know that you have to actively request your party ballot that you want to vote in. And all of this, I know it's a lot to keep track of, but all of this is available at easycleanelections.gov to help you through the process. So thank you for having me today.
Great. Thank you so much, Gina. We really appreciate it. Next, I am going to turn it over to former AARP Arizona State President and also former Access Director, Dr. Len Kirshner. Dr. Kirshner, please take it away.
Yeah, I'm going to spend the next half hour talking with my friend Dana Flannery from Access about this wonderful program that both of us dearly love. I was a second director, 1987 to 1993. Dana, when I started, Access had 185,000 members. When I left, we had 500,000. If you had told me that Access would cover over 2 million people, I would have said, impossible. Well, understand that Arizona was the last political body to start a Medicaid program. 49 states, DC, Puerto Rico, the Virgin Islands, Guam, Northern Marianas, and American Samoa had Medicaid programs when Arizona finally joined in 1982. It is now the largest healthcare program. And it's also the program that is there when problems develop. And so we're going to talk about things like COVID, but clearly when HIV was an epidemic in the 80s, it was Access that was the only program that was there. When Medicare needed help in providing long-term care to its members who needed that, it was Medicaid that came to the rescue. When Flint had contamination of its water supply, it was the governor who used Medicaid to provide services. And during COVID, we have seen an explosion of eligibility because of the public health emergency. So Dana, I'm going to turn it over to you and we can have a conversation. And we've got the next 30 minutes. And we really look forward to having people put in the chat any questions they have about this incredibly important and incredibly complex program. Dana, you've got it.
Oh, thanks so much, Len. Pleasure to be here. Thank you for having me. I'm the Senior Policy Advisor at our state's Medicaid agency, Access, as Dr. Kirshner mentioned. And also I am able to be the Assistant Director for our Division of Community Advocacy and Intergovernmental Relations. So today I will hit on some high-level priorities that this agency has for the remainder of 2022, as well as some other amazing things that are on the horizon. So I know I had shared some slides with you all. If you are able to pull them up. Thank you so much. Okay, we'll go ahead and get started. Okay. Just as in the last couple of years, we have a lot on our plate as the state's Medicaid agency. And so I'll talk through again, high level priorities that we have this year. This is not a total list, but these are the big ones. And I bolded up top the 3 main priorities that we are not losing sight of throughout the entire year. And so I'll talk more about unwinding from the public health emergency. I have a few slides to walk through timelines and actual plans that we have, so I won't spend much time right now focused on that. And then I'm going to talk about our 1115 waiver negotiations. That's a very big priority for the agency. So the majority of how Access, the state's Medicaid agency, functions here in Arizona exists in that 1115 demonstration waiver. It's an agreement between Access and our federal partners at CMS. So these waivers, the 1115 waivers, are typically approved for 5-year periods. And so we were due to expire last year, but due to the pandemic and competing priorities, which I'll share a little bit more about later, our federal partners at CMS granted us a year extension. And so the extension will expire at the conclusion of September. So we're currently negotiating our current waiver packet. And so a lot of what goes on in Medicaid is in that packet. So some very basic items such as managed care, home and community-based services, et cetera. But we added some additional items to this waiver packet. And so I'll just give a high-level overview of those. And so one is Target Investments 2.0. Some of you may be familiar with Arizona's movement on integration, and really over the past decade, working for our members that we serve to have an integrated healthcare plan that serves them. But this Target Investments looks more at the provider level. So at that point of service, so where a member goes and receives their services, can they address all of their needs? So really getting away from treating physical health separate from behavioral health. And some of these target investment funds were even used for criminal justice clinics. So a great example would be upon my release from an incarceration, for example, I would be able to go see my probation or parole officer, as well as my physical health, as well as my behavioral health. And then I could even discuss my housing needs and have a peer support. So that type of integration from the point of service, which has proven quite effective. So Target Investments 2.0 takes that original 5-year, which ended up being 6, program that we had, and taking it another 5 years. So the original group of providers that was involved, allowing them to continue on their successful journey, and then giving another opportunity for other providers to come into that space. So again, looking at the member vantage point and how easy it is to access care for everything that's going on with them. Then our housing and health opportunities, affectionately called our H2O waiver often, looks at housing. So when we're talking about whole person care, we talk about physical health, behavioral health, but there's also this component of our social determinants of health, right? Things that contribute to how we are able to function in the world. Do I have a roof over my head? Do I have food to put in my belly? Do I have access to running water? What do all of those other factors look like for me? Because if a PCP, a primary care physician, is giving me some suggestions of what to do with my life, if those basic needs aren't met, I may struggle a bit more. And so really with our health and housing opportunities waiver, we're looking to further what Medicaid has already been able to do here in Arizona in that housing space.
Dana,
Yeah.
housing is healthcare.
Thank you. That's my punchline.
But we really didn't understand that. And today, Access, as I understand it, is the 3rd largest housing authority in the state of Arizona. Is that correct?
Yes, that is one way to look at it. I do have some figures for you that can kind of speak to your housing is healthcare. So in 2020, we had almost 2,500 individuals housed through different housing monies that we receive. And of the cohort of people that were housed, just some fun data points, because I love data. We had 31% reduction in emergency department visits, a 44% decrease in inpatient admissions, 92% reduction in behavioral health residential facility. And then just for an average savings, we saved about $5,500 per member per month of individuals that received housing. So housing is absolutely healthcare. And it's also looking at that concept of least restrictive environment for an individual to go through their journey of healthcare, recovery, however you may look at it. And so it's very exciting to have this housing waiver in front of our federal partners. I don't know if you're following any of the national noise, but California recently had one approved that had some similar components to ours. And so ours has a 3-prong approach, really looking at strengthening homeless outreach and service engagement. So engaging those members that are currently homeless in their healthcare, securing funding for members who are homeless or at risk at homeless. So looking at the current dollars we receive and looking at opportunities with our federal partners to increase those monies. And then also enhancing wraparound services and supports. And I really like to focus on that component for people going through transitions. So think about coming out of an inpatient stay for a prolonged period of time. Think about coming out of an incarceration. These are huge opportunities to really engage people in their healthcare, but they're also huge opportunities missed if we don't have a lot of opportunities for that engagement. And so that's very exciting waiver that we have in front of them as well. And then traditional healing. So in conjunction with our tribal partners throughout the state, we've been in pursuit of an option for reimbursement for traditional healing. And this is also included in our current waiver package that we're negotiating. And then also tribal dental. So that's tribal dental, it's reimbursement for adult dental services for 100% federal financial participation.
Dana,
for
on the tribal issues, I think one of the most interesting ones where you'll pay for mule rides to bring people up from the bottom of the canyon, have a supai.
Yes,
That is unique in this country.
I know. It's very exciting to be able to share that on national calls. We were definitely the first state to be approved for non-emergency medical transportation by helicopter or mule. But that just goes to show this great state and our geography and how versatile it is on our frontier, rural and urban areas. And so I really do think we were able to meet the needs of our tribal partners and Arizonans to be creative, and our federal partners as well. Thanks to them.
I use that point of in all of my national calls. I've got one on Friday, Medicaid Matters, and always enjoyed mentioning that.
Yes, it is a fun fact for sure. And you definitely get some chuckles from people because they think we're joking, but once you are able to show them maybe a picture of the geography and what we're working with, it's easily understood. And luckily, a lot of people have come to visit our great state, and so they have a better perspective of that need. So that's a little bit about our waiver. So that's the second major priority. And then the third major priority, hopefully many of you have heard about opportunities that our federal government gave us through the American Rescue Plan Act. We always do acronym soup, so ARPA is what we call it for short, but it's American Rescue Plan Act. And it provides states with a temporary 10% increase to what we call as an FMAP. That's that federal medical assistance percentage. So the federal match, if you will, to certain expenditures that we have for our home and community-based services. And so we had to use the federal funds, that extra drawdown, if you will, and to supplement, not supplant, our existing funds. And we have to implement or supplement the implementation of activities to enhance, expand, and strengthen our home and community-based services program. In Arizona, we are well known for our home and community-based services program, again, allowing people in their most natural environment to receive services. So the populations of focus throughout this home and community-based ARPA opportunity include Arizona seniors, individuals with disabilities, individuals living with a serious mental illness, and children with behavioral health needs. So it's very exciting. If you haven't tuned in, we have a wonderful, robust spending plan on our website that talks about all of the things that we will do over the course of the next few years with this opportunity in front of us. And so it will also be able to look at, not everything happens in a vacuum. So, Dr. Kirshner, as you mentioned, the impacts of the pandemic. There are so many different impacts we could talk through for hours, but one of them is our workforce. And so we have a lot of people with a lot of needs right now. And then we also have a struggling ability to retain, maintain, obtain the workforce to do all this amazing work, including that for home and community-based services. So we are very optimistic and hopeful with these extra monies from our federal partners that we're going to be able to do some creative things to help our provider community out, which in turn, of course, helps our members out. All right, so those are the big three at the top, but business as usual. Lots of things happen in Medicaid. And so we have different things that are going on, different contracts that are expiring for different populations. And so really working through that. So one of those is the readiness and the launch of our Access Complete Care Regional Behavioral Health Authorities. So that goes live on 10/1. We awarded those contracts some time ago, and we're working through our readiness activities. That plan, that line of business, if you will, serves individuals living with a serious mental illness. They also are able to work through our grant funds that we received through our federal partners at SAMHSA and those opportunities. And they're also in charge of our crisis system, which I'm going to talk a little bit more about later. So we have that going on. We also have initial preparations for our all-text bids. So just like everything else in healthcare and in public healthcare, rather, the contracts eventually expire. And so when those all-text plans are up for term, we'll have another bid process for that. And then we have our continued prioritization for our COVID-19 response, including increasing those vaccination rates, continued rollout of community cares. I talked a little bit about integration of physical and behavioral health, but also looking at social determinants of health, housing, et cetera. We have a lot of different things in our program, in our different systems, where we try and refer people to natural needs that they may have. So a great example of this would be a food box. And
So
for a
Dana?
long, yeah,
We're very comfortable with all the acronyms. I would imagine some people listening in have no idea what Altix is. It's the Arizona
sure.
Long-Term Care System. And it's a subset of the Access program. Access started in 1982. Altix got started in 88, 89. And it takes care of some of the most vulnerable populations, those who need to be in nursing homes or can be cared for at home with home and community-based services. And it's been a model for the rest of the nation. So Altix, Arizona Long-Term Care System, part of Access.
Thank you so much for that, Dr. Kirshner. You're absolutely correct. We do have acronym soup, so that helps me out quite a bit. And fun fact about Altix, whenever we discuss the journey to integrated healthcare here in Arizona, and we present on it nationally quite a bit because we're well known for it, Altix was actually the start of that. Very early on, it started in inception as the program as treating people with their physical and behavioral health, all from that same plan. And so that was really the start of our integration journey, was through Altix.
And Dana, that part of our 1115 waiver took 23 months of negotiating with the feds to get approval.
Well, I commend you for doing all of that, and I thank you, and we carry on your negotiation spirit. Had some earlier today. All right. So just closing out on the closed loop referral system, no pun intended. What we're looking to do there is, instead of just referring people to different opportunities that they have in the community, is having that closed loop. So if I am sent to go get a food box of sorts, it will let my provider know if I was able to obtain that or not. And so instead of just sending people out towards all of these referrals and not having that communication and closing the loop, so we have opportunities there that we're rolling out this year as well. So just high level, some 2022 priorities. It's going to be yet another busy year for us and many other things. So we'll talk a little bit more about COVID now. All right, so special kudos to the entire Access team for our COVID-19 response over the past couple of years. We have been very, very busy and albeit very successful in a lot of the things that we were able to pursue with our federal partners and work through this pandemic. So next slide. So as Dr. Kirshner mentioned earlier, the enrollment continues to rise at Access here in Arizona. And so looking at that very first month of the pandemic, where we were at under 1.9, all the way to now, where we're really hitting that over 2.3 million mark. And so over 500,000 increase there over the time. And there's a reason for that. In addition to just the pandemic going on, there was something called a maintenance of effort requirement, that in order to receive enhanced federal match, so enhanced federal monies throughout this pandemic, we had this requirement to not disenroll anyone. So there were very few exceptions to that. So obviously someone passing away, moving out of the state, or them deciding themselves to disenroll were the only reasons that anyone could have come off of Access throughout this pandemic. So naturally the pandemic would cause more people to be on Access, but also there was no longer that churn of people coming off of Access. And so next slide.
Yeah, that's amazing. Prior to the 2020 election, we heard a lot from Bernie Sanders about Medicare for more, or Medicare for all.
Mm-hmm.
The reality over these 2 years of COVID, it's been Medicaid for more. And that's nationally 500,000 in Arizona, 15 million people getting healthcare nationally. So
Yes.
Medicare for all, we don't hear that much anymore. But Medicaid for more is clearly part of the conversation and will be when the public health emergency ends.
Yes, it's been very, very critical during these times. And we've definitely received a lot of feedback about how life-saving it's been. And in general, I think Medicaid has that position, right? But also during such times of a pandemic and that uncertainty. So making sure that you have access to healthcare. All right, I think our slides maybe went in the wrong direction. There we go. Okay. So just a couple of things. Again, it was a very large agency response to this pandemic, but this is just some high points. So we maintain that coverage for all beneficiaries during this public health emergency. And then right out of the gate in March, in the very first month of the pandemic, there was opportunities afforded to us by our federal partners for flexibilities to be able to be nimble and to address the needs of our members, our providers for addressing a pandemic. And so the team at Access was very quick to respond and obtained over 47 flexibilities. And so each of these have a unique vehicle that they have to go in, and we negotiate with CMS and get approval. But just some highlights there was telehealth, parents as paid caregivers, expediting provider enrollment. But we have a full list on our website of every single flexibility that we obtained during this public health emergency. We had over 126 million in pandemic relief funding that went to nursing facilities and those providers for home and community-based services we talked about earlier, and hospitals. And then we also implemented different strategies to increase COVID vaccine rates among vulnerable Access beneficiaries. So the vaccination rates as high as 78% for those on Altex. I think it's actually tipping a little bit more this month. I'll have to look at the updated figure that came in yesterday. And then we had a crisis counseling program. In addition to Arizona's robust crisis system, we had this program that was very dedicated to responding to the crisis of the pandemic itself. And through that grant, which just turned out, we were able to serve over 17,000 individuals statewide to get them counseling, group counseling, public education on coping with and handling the pandemic. Okay. So this is just a timeline looking at with that public health emergency. As many of you may know, there's a date of extension anytime that they extend it. And they usually extend it by approximately 90 days. And so with the most recent extension, it is set to expire of July 16 of 2022. And so what does that do? Well, the maintenance of effort requirement ceases right around August 1st. And that initiation of processing redeterminations, and then the expiration of the enhanced federal match we've been receiving. And so we have had news from CMS, our federal partners, that they're going to give us 60 days notice before the termination of the public health emergency. And so if that 7/16 date holds, we would get that notice in mid-May. And so right now ahead of us, we have some very important times of making sure that our education and awareness about the end of the public health emergency and what that means for anyone that you may know that's on Access, and really making sure that we are helping people understand that.
Yeah, Dana, for those who are not into Access, can you explain how much money came into the state because of the increase of 6.2% on the federal medical assistance percentage?
You know, Lynn, I would have to grab that number for you, but it is a significant amount of money that is entering the state. And it really is set to help set off that enhanced enrollment. So if you think back to that enrollment slide and how many individuals are on Medicaid now versus at the start of the pandemic. So it's a 6.2 increase.
And I believe it's in terms of billions of dollars.
Oh, yes.
Not millions of dollars. And it's significant. And sometimes I explain that Access has gotten so big that in previous years, the Access budget has been larger than the state general fund. And a lot of people don't know that.
You are always good with the fun facts. All right. So some of the stuff that we're doing to try and help prepare for the end of the public health emergency is that Access ourselves, as well as the managed care plans, are attempting to reach members who haven't responded to any requests. So just because we were not disenrolling anyone didn't mean that we were not reaching out to people to try and be prepared. And so here's just some things that we're doing to do robocalls to individuals, text messages, letters to households. So my plug to all of you is if you know anyone or know of anyone that is on Access, that all you do is just remind them to update their address, because they will not receive these messages from us if we don't have their current information. And then we're also leveraging our health plan partners to contact members when that mail is undeliverable. Okay.
Hey, Dana.
Mm-hmm.
We're running close to our 30 minutes. I need to ask Brendan, do we have our legislators coming on board?
Hey, Len, we do have our legislators coming on board. They are not with us just yet, so you do have a few more minutes. Thank you.
Let us know. I see Leila Alston, my friend Leila. Hello, Leila. And yeah, you let us know when we have to pull the plug and allow the legislators to come on board.
Sounds great. So here's just some community partner flyers that we're utilizing to help educate individuals for updating their address. And then I was asked to give a quick 988 update. So just some information about the National Suicide Hotline Designation Act. So it was signed into law into 2020. And all it's doing really is taking that number that exists today. So there's a 1-800 number for the National Suicide Prevention Lifeline, and it's turning it into a 3-digit number, very similar to 911. So that implementation is in July. And so SAMHSA in co-partnership with NAMSB worked on critical working sectors for playbooks and guidance, if you will. All right, I'll try and get through this quickly. So again, this is just to be a 3-digit number for people to access life-saving services for anyone that's experiencing mental health and substance use crises. So that number, that 988, will be available in July. And so here are just some fast facts that you'll have access to in the slides. And it will not replace our current crisis system. Arizona has been well known nationally for the crisis system built over the past couple of decades. And so that crisis system is available to all Arizonans. And so it has nothing to, you don't have to be on Medicaid. It's anyone in Arizona can access our crisis system. And what we're really doing with 988 is looking to how to pair the two and how to make them coexist so that it's an easier flow for the member. So you can just skip through this one and I'll try and get to what it looks like if you can go back to that last one. So today, the National Suicide Prevention Lifeline, the funding comes through SAMHSA, and there's 2 providers that we have in the state. And then for crisis, the crisis funds that Access distributes to our regional behavioral health authorities goes to 2 providers. And as you can see, one of those providers is shared across both lines of business. And that same provider happens to be the one that was just awarded the statewide call contract from our 3 REBAs. That's to go live 10/1. So there's a lot of opportunities for further alignment. So this NSPL launch, this 988 launch, looks different in every state. And so for a state such as ours, where we have a well-established crisis system, it's more complementary. Whereas in other states where they don't have anything set up yet, this is going to be their start into that journey.
Now, Dana, this suicide is another one of these crises where Access is so involved. Access has been involved in the crisis of AIDS, Alzheimer's, addiction, abuse, COVID. Every time there's a crisis, it's the Access program and across the nation, the Medicaid programs that are called to the front lines to handle these crises. And this is just one example in we're having an epidemic in suicide. We certainly have an epidemic in opioids.
Yes.
These are things that you, Dana, and Jamie and the rest of the staff should be congratulated because you have really been at the front lines of protecting the citizens of Arizona. And I'm so proud to have been a part of it. I want to congratulate you guys for all you've done bringing this program forward.
Thank you so much, Dr. Kirschner. Both suicide prevention and the opioid response are near and dear to my heart, and I'm very, very passionate about the work that we've been able to do for our citizens here. And so really urge if you don't know anything about our crisis services or our opioid use locator, treatment locator, feel free. Our website's pretty easy. It's www.azaccess.gov. And we have great links to crisis on the bottom. There's also a banner that goes across that can talk to you about our opioid services locator. And so hopefully it's just helping you all have an easier way to navigate whether you, your loved ones, or just you're trying to educate your communities if someone needs services. So my last plug is feel free to get more involved and know more about your state's Medicaid program. You can follow us on Facebook, Twitter, Instagram, LinkedIn, or YouTube. And we have a lot of fun fact videos that we're producing on our YouTube right now that's really helping to educate people on something that can be quite complex. The Medicaid agency can be complex to understand and to navigate. So thank you so much for having us here today and allowing us a platform to educate about unwinding from the public health emergency.
Dana, thank you so much for joining us this morning. It's been very informative and entertaining. Always enjoy chatting with you.
Likewise, thank you.
And I see my buddy Leila Alston smiling at me.
Thanks, Len. And thank you again, Dana. We really appreciate the time that you took with us today. We are going to go back and we now have, fortunately, we have some of our legislators who have joined us. We are going to start with Senator Rick Gray. And after our time with him, we will move to a conversation with Senator Alston and Senator Livingston. Good morning, Senator Gray. Thank you so much for joining us.
Thank you. And I apologize. I've just got my picture because my backlighting in my office isn't near as good as Senator Alston. So it doesn't work well for Zoom. But then I apologize too, because our air conditioner just fired up. So I don't know if you can hear it, but it's blowing like a whirlwind in here.
You're coming through clearly to me, sir. Thank you so much. I did want to just give you the opportunity before we go ahead and get rolling here. If you wanted to make any opening comments, I'll just say, first of all, to our attendees here that Senator Gray has been a big advocate for a lot of the work that AARP has done over the last number of years, including on long-term care and as we're going to discuss Work and Save today. So, Senator, do you have any opening comments you'd like to make?
No, actually, I will thank you as AARP that you guys were the ones that brought this bill to me. And I think the idea was tremendous. I've worked with our Sun City Community Assistance Network, which is, I live in a retirement community, and we deal with basically the seniors that are under the poverty line, usually women. It's usually the husbands that die off and the women are left, and all they've got is the Social Security, sometimes less than $1,000 a month, quite often. And so, this bill is something that really, it won't help them, but it can help keep us from having situations like that. And it's heartbreaking to see it. And I've been a longtime believer in, the more you can save, the better off you are. So I think the bill was necessary. Unfortunately, we didn't get it passed as we wanted to, but interestingly enough, we just got through with the work study amendment that we put on it. We just did the final read in the Senate today. So it's on its way to the governor.
That's great news. Absolutely great news. And also a big shout out to Sun City Can. They do a lot of tremendous work throughout the community there. So a good point there. So I guess we'll go ahead and just jump right into it. You've already talked about it a little bit, but can you kind of go over an overview of what this program is, Work and Save is generally, and sort of how you got attached to the issue?
Yeah, it's basically like a 401 retirement fund, but it's open to individuals. So there's a lot of gig workers out there, people that are kind of doing their own thing. They don't have a regular business, and they don't have access to good retirement accounts. And unfortunately, I mean, people can take the initiative and they can go out and start one, but the majority of people don't. That's a sad reality. And so this is an avenue that would help them do that. It would be run by the state. The NFIB, Federation, National Federation of Independent Business Owners, was on board with this. They were extremely supportive because there are a lot of small businesses that don't have the manpower or the expertise to set up a retirement program and to maintain it. And so this would be something to where if their employees were interested, it would be handled by the state treasurer's office, and it would help facilitate. And I think that's one of the key issues of why it was so critical, is if we can help reduce any barrier and help facilitate an easier transition into a savings account like that without the cost. And again, a small business owner could just set that up and it wouldn't take a lot of time and effort. That's going to encourage people. And if we can get enough people into that, it becomes habitual.
Right. I know you already mentioned this a little bit, and that we were disappointed that we weren't able to get it as passed, but could you sort of explain that process of how we got to where we are, and also what it is that we were able to get passed, as you just mentioned, and send off to the governor's desk?
Well, a lot of times new issues, new ideas are hard for people to swallow. We like the comfortable, we like the normal. And there were people that were concerned with why can't they just open a 401k themselves? And a lot of people in the legislature have, they've done that. But they don't understand that there are a lot of people that they don't have the financial understanding and they don't have the motivation where they may, if their employer allowed that, they would invest in it, but they don't have the wherewithal to kind of set it up. So when it's new and there's just some question marks about it, sometimes it can take a little while. In fact, I've heard more than once, you can have a great idea, but it may take 4 or 5 years to get it in and get the legislation passed. Now, I'm hopeful that it won't take 4 or 5 years. I'm hopeful that after this study committee that we'll be able to help people to see the value of this. And so next year, I hope to get this passed. I won't be down here, but I noticed you said that you had Senator Livingston on. He's been a supporter. And so I'm going to talk with him about seeing if he would like to help move this forward. Because since I'm not here, we need somebody that will. And Senator Livingston will be one of my representatives in my district. So I'm excited about that. But yeah, so to help get it through, we did reduce it down to a study committee. But again, I think that that's going to only help it because we're going to get more people that will actually begin to look at it. We had a great supporter over in the House, Representative Liguori, who was a former financial advisor. And so she really liked the idea. The more we can get people aware of it, the more, again, when it's new, it's just you're a little more hesitant. And when you've got a ton of bills and this is the first time you've heard about it, there's just a little more, again, reticence to jump on. So I'm hopeful that, especially with the findings of the study committee, we'll have a lot more members that'll feel a lot more comfortable and we'll be able to get it over the finish line.
Right. And AARP is trying to educate as many small business groups as possible to educate them about the issue as well. You already mentioned the NFIB partners that we had this year. We're hoping that we have a lot more next year as well, when we hopefully are able to get it done, the full thing next year.
And I do want to also pat you guys on the back because a lot of the information that you put out there was very impressive. I mean, and I think we need to get more members aware of that outside of the crush of the legislative session, because when we're in session, we've got hundreds of bills coming at us and there's just a ton of information to try and absorb. And so sometimes we don't take the time to actually read the extra material. And so I had sent that out to everybody. Stuart Goodman and his crew, Brandy, have been excellent at really working with members on this. But again, sometimes it just takes a little more time. And I think one more session will do that. And hopefully after the elections are over and we've got members that we know are going to be here, that'll be a great time to start setting up appointments and talking with them and explaining things to them and helping to prep this for the next tee off on the next session.
Right. And could you talk a little bit about oh, I'm sorry, were you saying something?
No.
Oh, okay. Could you talk a little bit about how AARP and our members can help push this and what our members, individuals, whether they're our volunteers or some of the people who listen to our some of our advocacy work via some of our channels. Can you sort of tell us what are some of the things that you think would be most helpful to get a piece of legislation like this through?
Well, one of the things I usually encourage people to do is meet with your representatives. If you're in Arizona and you are in a legislative district, you have 2 representatives and 1 senator. Schedule a time to meet with them, and whether it's in session or not, you can still try and connect with them, and then just again make sure they're looking at the information. You've got the information to share. Everything is about relationship. So the more you can develop that relationship, the more you can explain your side, the more that they can see the value of it, the better off we are as legislators.
Great, thank you. You know, one of the things that we talked a lot, you mentioned earlier was that some of the information that we had, and I think that one of the striking pieces of information for me was that only 5% of people will go out and start their own retirement plan if it's not provided through an employer. And I think that, you know, there are so many people in that boat who sort of just retire with only their Social Security available to them, that, you know, a program like this would just be so helpful to them and their families as they move into retirement.
Yeah, absolutely. Yeah, I think one of the things they had was that only 56% of Arizonans that are 18 to 64 in the private sector that have a retirement plan. And then one other thing I'll say too is, and this again comes from one of your papers, your reports, is the number of minorities that don't have. 69% of Hispanic workers and 56% of African Americans lack employer provided retirement plans. So that's another thing, you know, when you're talking with legislators, if they're Hispanic or African American, if they care about minorities, you know, this is a huge reason to support this, to again help those people put something together in a very easy format.
Right. And can you talk just a little bit about sort of the nuts and bolts of who you've mentioned the study committee and sort of can you mention the objectives of the study committee and who will be represented on the study committee?
Well, we don't have the members appointed yet, so that's going to be up to the speaker and the president. But I'm going to be trying to nurture that along with people that I would recommend to be on there. I see Senator Livingston just popped up on the screen. So he's going to be one that I encourage because of his financial background. Again, Representative Ligori, now she's in a competitive district, so we'll have to see if she gets reelected, but she can still be on the committee because the committee will go during her term. And I think, again, as somebody who's been involved in financial planning, she will have a lot to bring to the table too. So, but yeah, those members aren't specified in the study committee. They have to be appointed.
Great. We do have a quick question if you have a minute, Senator. Thank you for your leadership and being a longtime friend of older Arizonans. If more older citizens save in 401k type accounts, won't there be fewer future lower income seniors seeking assistance from future taxpayers? Well,
that's again another one of the reasons that I support it. You know, as a legislator, we have to fund social services, and again, some of the data that came from AARP clearly shows that if people are putting aside money, they have a potential of not having to fall back on the state coffers for support. So the more we can get people on their own, the better off we are. So yeah, that's another one of the factors of why this bill should be passed and why we need to continue working on it and why I was willing to reduce it to I'm not a big fan of study committees, but we need to keep this going because it's too important to the people who need it and to the state. Because again, the more we can keep people off of social services, the more we have money, taxpayers' money, that we can put toward other things.
Senator, we do have a question from my predecessor, Steve Jennings. He wants to know what your plans are when you're no longer at the legislature. He has spent the winter skiing around the Pacific Northwest. So he does have a question about that.
Well, I come from Omaha, so I probably won't be going to cold weather areas. We are going to be doing some travel, especially in August when it's hot down here. We're going to be heading up to the mountains and visiting Yellowstone and Glacier National Parks. So I'm going to be doing some travel, and then after that, we'll see. There hasn't been anything specific that I'm going to shoot for, but I am a goal-oriented person, so I will be doing something that will be able to be achieving things. That's just part of things that drives me.
Great.
So I won't be sitting around, and I've got 7 golf courses within a 3-mile radius of my house, but I don't play golf. So I've got to come up with something to do.
Right. Senator, do you have any closing comments for us?
No, again, I want to applaud AARP for all the data that you put together. I think this program is going to be hugely impactful for the people that will get into it. I think it will be hugely beneficial, and this is one of the things that your report shows. It'll be hugely beneficial to the state of Arizona because of the reduction of social service costs. So I want to thank you for all the work that you've done on this, and I know I'm going to leave it in good hands as I move on and out of session. But you know, I think that again, this is a great project, and I look forward to seeing it culminate in a viable option for people in the workforce.
Thank you, Senator Gray, so much for joining us today, and thank you for your efforts on the Work and Save bill this year. We really, really do appreciate them. I'm now going to pass it off to, once again, our Advocacy Steering Committee Chair, Hal Bergsma, who will walk us through our next session and also introduce our next speakers. Hal, take it away.
Okay, Brendan, thank you again, Senator Gray, for joining us today. It's my pleasure to introduce Senators Leila Alston and Senator David Livingston. We're honored to have them with us today. Just a little background on the senators. Leila Alston is from Phoenix. She represents District 24. She's a retired teacher. She's been a member of the Phoenix Union High School District Governing Board since 2008 and taught in the district for 34 years. Wow. In 2022, Senator Alston began her 30th year in the state legislature from 1977 to 1995. She served in the Senate. She returned to the legislature in 2011 and served in the House for 8 years. And she's back in the Senate since 2019. Senator Livingston is from Peoria. He represents District 22. He's a financial advisor. He's a former member of both the Glendale and Peoria Chambers of Commerce and is a past board member of the Glendale Peoria YMCA. He served in the House of Representatives from 2013 to 2018 and has been in the Senate since 2019. So thank you again both for being with us today. Would you like to make some opening remarks before we get into some questions? Any thoughts? And I'll say maybe going in that obviously housing is a big issue in Arizona these days. I spent a good part of my life in the Portland, Oregon area, which, like a lot of other West Coast cities, has been experiencing housing issues for a long time. And those issues are now becoming more and more prevalent in Arizona, especially in the larger cities of Phoenix and Tucson, where I live. So talk a bit about your views of housing generally in Arizona. And then maybe we can talk in more detail about your efforts to address housing issues. So Senator Alston, you want to start out?
Okay, I'd be happy to start out. Thank you for having us on your program today. I really do appreciate it. I came to the legislature and returned to the legislature primarily interested in public education. But public education in Arizona at the legislature has a lot of individuals who are concerned and advocates for that. And as we got more and more people involved in public education issues, I kind of shifted my focus to those other issues. And one of those is housing. We know that public individuals like teachers, firefighters, police officers are in a severe crunch right now as far as their ability to purchase or rent in the housing market. And Arizona's housing market has gotten much, much worse over the most recent years. I think that everyone's pretty aware of how much little houses in my neighborhood, for example, which is a historic neighborhood, are selling for $800,000, and they're about 1,500 square feet or fewer. But I really it brought it forth to me some years ago when my neighbor was brutally murdered on my street, a couple houses down from me, by a homeless individual. And so I became involved with his widow and other individuals, and have been on the housing bandwagon, if you will, ever since. So I'm happy that Senator Livingston has joined me in those efforts of concern about housing issues, and particularly for seniors. We know that low-income seniors are the fastest growing group of homeless in this state. It's called the Silver Tsunami. And Mr. Livingston supported a bill to put a senior housing unit in his district. It turned out it didn't go in his district, but he can talk more about that. But for several years now, he and I have been partners in promoting what we can do to increase the dollars going into housing and to make some significant stride in meeting these needs, particularly for older individuals. One of the things about this growing population is most of them are first-time homeless, and in addition to their age, they may have medical issues, and they don't have the street smarts to protect themselves in this situation as they experience homelessness. So I'm a big advocate, and I really welcome Senator Livingston's partnership, and we'll talk more about our bills a little later. Thank you.
Right. Thank you. Senator Livingston, you want to talk a bit about your views of the housing issues in Arizona and how you want to address them?
Sure. Thank you, Hal, for having me. And I'm really happy that I'm doing it with Senator Austin together. Not only is she the Dean of the Senate, a personal friend, but somebody who's mentored me, tell you the truth, on some of these homeless issues. I would say 5 years ago, I didn't know anything on the issue. And now I'm running all these different bills. So we'll get to that in a second. Mostly, though, what I do down here, I'm the numbers guy. I have a numbers background, and numbers are just easy for me. So I do all the financial stuff, insurance stuff, pension stuff, budget stuff. But I have these handful of homeless bills that we've been doing. Senator Austin mentioned the homeless bill we did last year together that allocated $5 million to buy a hotel for senior homeless. And then the governor increased that to $7.5 million. And I think City of Phoenix, I think, put $3 million into the project. And that's going to be opening up here in the next 8-9 months, I think, and be fully occupied. And Cass is running that hotel that they bought. And general homelessness that you were talking about, there's when you're talking housing and homeless, there is some overlap there, but I think in a bigger picture of scheme, there isn't. I think that, housing prices in Arizona are going to continue to go up. And I think the number one reason is there's a shortage of new homes being built. Simple as that. And why is there a shortage? It used to take a builder, under 24 months of buying a piece of raw land and then opening it up and selling homes. Now it takes between 4 to 5 years. And when you add that type of administration cost and rules, regulations, and permits, it increases the cost for the builders, and therefore that increases the cost for the consumers. And we have to get a better handle on that as far as speeding up the process of building a house. And permitting is the biggest downfall. So that's a separate issue. Now, when somebody can't get any homeless and rents are going up and everything like that, and then yes, we do have new homeless coming in. One of my biggest things that I've been pushing and not happy with on the number side on homelessness is 600 people died in Maricopa County that are quote unquote unsheltered. And that's a term I didn't know what that meant, but unsheltered is somebody in homelessness that are not using current facilities. They're outside camping or sleeping under a tree or whatever. They call that unsheltered. And frankly, it just breaks my heart that 600 people died in Maricopa last year, unsheltered. And that should not be acceptable to a conservative like me or a progressive like Senator Austin. And that's why we're working together, because it isn't acceptable. And we have a couple of bills here I think we can talk about today that we're trying to address that. Not an easy answer, but an answer that has to be found.
You're right. There's no easy answers here, and that's why it's so difficult. So Senator Alston, you have introduced a bill that would add a lot of money to resources for providing more affordable housing. Senate Bill 1531. You want to talk a bit about that?
Certainly. Of course, I love talking about that bill because I have introduced it repeatedly from when I was in the House till now. The Homeless Trust Fund has been in existence for a long time. During the recession, the amount of money that was coming into the trust fund was reduced from a percentage of lottery funds, the sale of not lottery, the sale of unclaimed property funds. And it was at sometimes in the high 30 millions to low $40 million a year. And what happened during the big recession is that was cut back, and the only $2.5 million per year was allocated to the Housing Trust Fund. So my bill 1531 originally restored that. It works out to be about 55% of the sale of unclaimed property to the Housing Trust Fund. And that is what I consider more or less permanent situation, so that the Housing Trust Fund would have not adequate, but at least much more than $2.5 million every single year. It would be something that would be ongoing. And we amended with my approval in Senate Appropriations Committee. It was a Livingston amendment to add, strike my bill and add $100 million, which is a huge, huge sum that could really go a long way in meeting the needs of housing in Arizona. And that is because we have a surplus of funding right now. This would be some of the COVID dollars, which certainly is an appropriate use of those. We got the bill out of the Senate. It was never heard in the House. And so that's why you'll see another bill that Senator Livingston found, and we put that $100 million onto the second bill. So those are my primary efforts. There are a lot of other things like and one of the things we have done is to allow properties that serve low-income families or individuals to maintain their property tax position even after they've fulfilled their time of service, if you will. But if they keep those properties in still for homeless or for low-income housing, that they can maintain that property tax situation. So that's one of the things that has happened. So those are my contributions primarily, and Senator Livingston has really jumped in full force, and he's got several bills that I think he would like to talk about that help as a package meet our needs, or at least make a dent in what we can do.
Thank you. So Senator, tell us about the bills you're involved with.
Yep. So the senator mentioned the property tax bill that already went through. That's a little bill, but it's a really important bill. because if we didn't do that, you could have seen existing low-income housing projects stop doing low income and
Right.
raise it to market rents. So that was I mean, it's a little bill, but it's a pretty significant bill. Another little bill, which I think will become significant, is my bill 1263. And what 1263 does, it adds about $2 million from the lottery funds to allow nonprofits to use for administration costs and a grant process to run the operations. So that's one of the bills that we kind of put together as a package. And that's close to being, sent to the governor, but, we're in the budget talks right now, so it's a little slow, but it's all ready to go. The third bill that Senator Austin mentioned was she had Bill 1531 that unfortunately got stuck in the House. So now we took that same bill and we added it and replaced Bill 2528 on Hernandez's bill. And that's the one that does $100 million now for the Housing Trust Fund. Very, very significant bill. And again, once we get the budget closer to being done, I would expect to see this go up during budget week, hopefully, as is. I don't think there's any more amendments needed to that bill. And that's something that the senator and I have been working on for a number of years on. And hopefully that we can get this one signed and then maybe even do it again next year and add another $100 million. But we have to get this one done first. I do have two additional bills that I wouldn't mind mentioning. Today, we actually voted on 2610 and it passed out of the Senate today. I think the vote was 25-1 with 4 absences. I'm not exactly sure that was a vote, but memory is around there. And that was another one of those little bills that would make a big long-term impact. For low-income property tax exemptions, it was capped at 200 units. So let's say we get a developer that wants to do mini houses. And they want to do 1,000 mini houses or 500 mini houses. They couldn't have qualified under low income tax credit. Now they will. So that bill is going past the Senate today. It's going over to the House. Hopefully the House will vote on it, pass it, and then it can go up to the governor. There's no money on the bill, so we're not holding the bill. And hopefully next week that bill will go up to the governor. The third bill is the one that we've been having the most negotiations on, tell you the truth, or the fourth bill, and that's my 1581. And 1581 looks at the unsheltered homelessness differently than it's been looked at the last 5 years. And I think that's important because last year unsheltered homelessness went up 30%. So yes, we need to put more money, and the 100 million would do that. But I think we also need to do different approaches to find something that's working better. And that was the approach I've taken on this. I'm in the final draft of the amendment on this bill. Leila and other members haven't seen it yet, the amendment. We're just working on language. I'm hoping to get it today or tomorrow so I can share it with her and other members in the nonprofit community, and then work on it over in the House. That's where the amendment will go on. It is a money bill. It allocates $50 million to focus on the unsheltered and frankly, how to get all these camping areas of tents on the streets off the streets, because those are where the people are dying. 600 people. And they're not safe and they're dying and there's drug use and all kinds of problems. So we're trying to set up a new program for that. And if we can get it signed and in law, the goal would be to bring additional funds into that the following year also, but we have to get it up and running and established on that. So there's been lots of meetings on that, and we're close, but we're not quite there yet today.
Yeah, that's a real tough issue, and I know it's controversial, but I certainly respect you for trying to deal with this issue. It's not easy. I personally. I spent a while last summer, a little over a month in the Portland, Oregon area. And you see that all over the place up there. They're still grappling with some way to address it. So I thank you for taking that on. So we're doing a lot in this session, but obviously it's not going to be enough. There's still more to do. What are you thinking about doing going forward?
on my point of view, it's continuing to reach across the aisle and making this a team. And trying to get, in the Senate, we have 30 total votes. When I reach across the aisle, my goal is always 25 votes. If I can get 29 or 30, hey, that's great too. It needs 16 to pass, but I just set a personal goal when I try to make something bipartisan as 25, because it's just a nice round number. And I'm a numbers guy. So continue to do that. I think that's the best way to work on these issues. There's no one way to solve any of these issues, but we have to acknowledge that there's a real problem and people are dying and we have to take action. And I think the team of us working together has been doing that. And I see us continuing that doing the next year, even though our district numbers are changing. And I'm going from District 22 to District 28. And I'm in the Senate now, and I'm planning on running for the House next year. I'm happy to come over here and see the senator and work together with her.
Thank you. And I would like to mention one other bill that's in play here in the Senate. It's House Bill 2477 that is Mr. Carroll's bill. I've been working on this issue for a long time, and it is a subsidy for low-income seniors to assist in payment of their property tax. We had a fund some years ago that did this very thing. It was limited to Maricopa County only because Maricopa County Treasurer's Office is the only one who wanted to participate. Other counties could have, but chose not to. There were some issues about the funding. The funding went away some years ago, and finally the fund was used up in making these grants or subsidies to help taxpayers who own their own homes be able to pay their property tax bills. And that bill is now Mr. Carroll's bill, 2477. It is it come to us and is waiting in Senate rules. So it could pop out anytime. We probably just need to put a little pressure on some folks here who determine when bills get moving. But I worked closely with the Maricopa County Treasurer's Office, and I worked with them in years before. We have a new management now in Maricopa County Treasurers, and that's former Representative John Allen, who I became friendly with when he served not too long ago. And so John has been wonderful, he and his team, in finding solutions. And this will it's state funded with, I think it's only $6 million, and it will reach people statewide. It's not a total payment of their taxes, but a help. And since it's general fund money, it's appropriate that it goes statewide, and it will be managed by the areas on aging. So Mr. Allen did not want to be in the business of managing this account. So he was very creative in finding an agencies that could do this, that, is just kind of part of what they already do. So we're really hopeful that bill will get out, because people are losing their homes because they own them, but they don't have the money to pay their property taxes. And that's, just a real shame. And it will also include mobile homes or structure built buildings. So it's not limited to what we think of as regular housing.
Thank you. There was a bill introduced early in the session from the House. I think it was Representatives Kaiser, who's a Republican, Chavez, who's a Democrat. I can't remember the bill number, but this was a bill that would basically override local government zoning for residential uses anyway, and replace it with sort of a state zoning code that would have, getting back to what Senator Livingston was saying, that would basically make it a lot easier to develop in residential areas and to develop at somewhat higher densities. I'm addressing this because my background is as an urban planner for local governments. So that bill obviously received a lot of opposition from local governments in the state. It was dropped, and I think it was converted into a bill that would establish a study committee to look at the issue in a broader sense. I'm not sure where it's gone since then. What are your thoughts on that? I mean, is it important to, and this has been done in Oregon and in California, is it important to start looking at loosening up local zoning for residential areas so you can do more development in those areas of affordable housing?
Well, I think it's certainly something that should be looked at, but also I think it would really be important to make it to bring in local communities or local city governments into the discussion for individual communities, because and across the board may be the reason it's getting so much opposition, where if we change zoning rules community by community, we might have a better opportunity to have buy-in from that community. And I know that, you know, preemptions of by cities and towns, and I think they would be particularly resistant to us taking over their zoning powers. We would get more results if we did it as a non-mandatory issue. But I do not know that bill well. It never got here that I'm aware of. And so, you know, I just don't really know all the ins and outs to really properly address the specific issue of that bill.
Thank you.
Senator, yeah.
Go
So
ahead.
a couple of comments on that bill and those other two that the senator mentioned. So the House bill that you just mentioned, I don't have the number in front of me, but it was too big and too aggressive with too little community input. And that's a really bad combination. So they definitely need to do some stakeholder meetings. And, you know, we need to, you know, when everybody complains of not in my backyard to build units, a low income or whatever it happens to be, that's not acceptable. You know, we all live here and there's people that need help, and we need to think bigger picture, not just in my little city. The bill that the senator mentioned, 2477, the CARA bill, I'm also very supportive of that. We passed that out of approps. It's a money bill, so it's part of the budget now, but I think it has pretty good momentum, so hopefully survive. And there's another bill related to that, 2351. And that's the homestead exemption bill that was in my name that I put onto a House member's name, Udall. And it failed yesterday on the House floor. And to tell you the truth, I don't know why. And they're not here today in general, so I'm working on that. But it's important for us to bring that bill back and pass it out of the House. The homestead exemption protects people from bankruptcies mostly and keeping their house. If they lose a house in bankruptcy and then they're on the street, that doesn't do us much good. So it used to be for like 3 decades at 150,000. And then last year we raised it to 250,000, and that passed, it got signed into law. And then this year we were attempting to raise it to 450,000, which is the average sales price in Arizona now. And what we're trying to do, you know, about 30% of people in the state that own a house have it free and clear. And a lot of those tend to be seniors that lived in the house for 30 years or whatever. We want to protect those houses so they're never forced to, through bankruptcy, to leave. And there was some discussion that 450 is too high. Since that's now the average sales price of a house in Arizona, I disagree with that. I mean, you know, it could get everybody to vote if we change it to 400 or 375 or 450. I could accept that, but I think it's easier just to pick a higher number and just lock it down there and have it there. So hopefully that bill will also come back. And I think what you're seeing is we have a whole bunch of individual bills working on the issues, and it's a much better way of doing it, because every year good bills do die and bad bills die fast. But the good bills that die, it allows us to bring it back the next year. And if we do little by little, I think we get more bills through the system and makes a big difference.
Well, thank you both for your comments and for the information you've provided to us today. We're running out of time, so we're going to have to call a conclusion to our discussion. I'm now going to turn it over to AARP Arizona State Director Dana Kennedy, who will close our program. Thank you again.
Thank
Thank
you.
you.
And thank you, Senator Livingston and Senator Austin. It's great for you to join us in all the work that you're doing to help the homeless population. And I want to thank each and every one of you for joining us today. We couldn't do all the work that we do without you. And as you heard from Senator Livingston, our work is far from done. We have a lot of advocacy left to do to get these bills across the finish line. So we're counting on you to make sure that you reach out to your elected officials and make sure that they hear from you on these important topics. And I also want to thank Brendan Blake and Hannah Baird and Hal Bergsma and Dr. Kirschner and all of our planning committee for making today such a success. A lot of work went into this. It doesn't just happen. And the logistics during legislative session are often challenging. So thank you so much. And this concludes our program. Have a great day. And hopefully we'll be in person next year.
Yes.
Yes, look forward to that. Goodbye and have a great day.
Bye-bye.
Bye-bye.